Well, we've been talking about the humanitarian crisis in Yemen for some time now. It's been some 6 years since the country has found itself locked in a savage war, a difficult war. And now add on to that the coronavirus. There's believed to be 1,000 COVID-19 cases across Yemen, but the exact number remains unclear as fighting continues between Iran-backed Houthi rebels and separatist groups and the Saudi-backed Yemeni government. The United Nations is pushing for a new ceasefire so Yemen can focus on the virus amid years of civil war. So we want to bring in Elizabeth Palmer now to give us a better insight into what's happening in that country. You know, Elizabeth, I said about 1,000 COVID-19 cases, but we don't even have an accurate gauge of how many people are positive in this country. I can't imagine there's a way to determine just how many people are positive in Yemen.
Really, it's completely opaque, and everybody is guessing. There's some mathematical modeling going on, but honestly, nobody knows. Just to give you a picture of what's going on, the civil war has divided the country. The so-called government, which is backed by Saudi Arabia, controls the south of the country, and they have reported just over 900 cases, 250 deaths. This is in a population of about 27 million people overall. The north of Yemen is controlled by the Iranian-backed Houthis. They've reported just 4 cases, so that's clearly not accurate. The bottom line, as I said, is we don't know. The modelers are from the London School of Hygiene and Tropical Medicine, and they predict that perhaps as many as 1 million people have already been infected, but no reporting of that.
And so, Liz, I mean, given the situation there in Yemen, are officials equipped to cope with an outbreak of this pandemic? I mean, you see what happens when even a large, wealthy country, witness the United States, tries to contain the coronavirus. What about a country that is in dire straits like Yemen?
Look, I think it's hard to overstate how catastrophic this is. Even before COVID, the country's network of clinics and hospitals was barely coping. Some of them I've visited, some of them about 1.5 years ago, and they really are often just little concrete block buildings in the middle of the countryside with the most basic of medicines and facilities. They probably have clean water, and that's enough to transform them into a clinic that people go to if they can get to. So you can imagine that this very serious virus will completely overwhelm such a rudimentary system. There is one dedicated COVID unit in the country with the right equipment and staff. It's run by an international aid organization, Doctors Without Borders. It's in the south. It's full up, as you can imagine. And of course, it's simply not accessible to the millions of people who live in the north of the country. So to quote one of the doctors in that special COVID unit, doctors who kept the hospitals open through the worst of the fighting in the south of the country, he says, the catastrophe we all feared was coming has now arrived.
You know, you were in Yemen in 2018. I remember thinking at the time, looking at some of your coverage, that what is so heartbreaking about the situation there is that it's entirely man-made. And if I recall, and you can correct me, Liz, that you know, at the time you were talking about children who were starving and malnutrition, I believe, and that was going to be sort of the next wave of the humanitarian crisis. But it seems like in Yemen there's wave after wave after wave. And much of what they are dependent on is the international community to help out. Is that happening?
Poor Yemen. It really can't catch a break. Amazingly enough, UN managed to broker a ceasefire in April. It lasted 6 weeks. It was supposed to allow the country to draw breath and try and come to grips with COVID. But both sides, it kind of fell apart after 6 weeks. And since then, both sides have complained that the others are attacking. To make matters worse, there's internecine fighting in the southern, among the southern forces. So it's a mess. And of course, that means that there's no central planning, there's no policy. Even if there's money, there's no central body that can come up with a plan for the best way to spend it. Now, the fighting, sporadic as it is, does make it very dangerous to move, so people are not going to hospitals when they should, and when they do get there, often it's too late, so they just go there to die. The roads are in rough shape. Some of the hospitals are shot up. And the fighting means that there are roadblocks everywhere. It's terribly difficult to get around. The WHO flew 43 tons of good equipment in just last week, ventilators, test kits, PPE for the staff. But now they've got to drive it around the country to get it to the worst hit areas. And that might not happen at all. If it does, it will be very slow and very dangerous.
Really, really tough circumstances. Elizabeth Palmer, thank you so much. Appreciate it.
Pleasure.